What is endoscopic spine surgery? Endoscopic spine surgery is a modern minimal invasive technique for spine operations. Instead of making a large incision as in traditional surgery, the surgeon uses a tiny incision, often a few millimeters long, say 6 to 8 millimeters, the size of a pencil, to insert a thin tube into the body, and an endoscope, a small camera attached to the scope, goes in through the tube, providing a clear magnified view of a spinal area on the screen. Special surgical instruments are passed through this small tube, and using this setup the surgeon can remove or treat the problem, such as a spinal tumor, without needing to cut or disturb the large muscles or remove significant bone. It's a keyhole approach that leads to far less trauma than open surgery. How we remove a spine tumor endoscopically? So for a endoscopic spine tumor surgery, you will be under general anesthesia, completely asleep. The surgeon makes a small incision, few millimeters, specifically in the area of interest in your back near the tumor location. Through this tiny opening, a narrow tube, that is endoscope, is inserted to the area of the tumor, and an endoscopic camera provides a close-up view of the tumor and nearby nerves in the monitor. The big advantage is that it is so magnified, you can see the things very clearly. Watching that, the surgeon uses very small instruments through this tube carefully to separate the tumor from the surrounding normal nerves or spinal cord and completely remove it. The irrigation helps to increase the visualization. Often the tumor is taken out in tiny pieces through the tube. Once the tumor is out, the instruments and camera are removed, and this tiny incision is closed with either one small stitch or a staple. What are the benefits of this endoscopic technique for spinal tumors? Using an endoscope to remove a spine tumors offers several key advantages. The incisions are very small, in few millimeters, which means minimal damage to the muscle or bone. As a result, patients usually have less pain after surgery and only tiny scar. Because we aren't opening a large area, there is much less blood loss and lower risk of infection compared to open surgery. The endoscopic camera also provides a magnified view, helping surgeons to avoid injury to delicate nerves while removing the tumor. Recovery is typically faster as well, often just a short hospital stay, about a day or two, instead of a week or more with traditional surgery. In open surgery for spine tumors, we usually put a drain which will be there for 3 to 5 days, and there will be some blood coming out of it, or sometimes cerebrospinal fluid, which is more morbid to the patient. In endoscopic spine surgery, this is not there because your incision is so tiny. There is no need for any tubes to be placed post-operatively, as a result of which patient goes home the same day or the next day with a faster recovery with less complications. What to expect in recovery after spinal tumor surgery using endoscope? Recovery after endoscopic spine tumor surgery is usually much faster and easier than after traditional open surgery. Because the procedure is minimally invasive, you start moving around sooner, often the same day or the next day. The hospital day is very short. Most patient goes home within a day or two. You will have some soreness in the back, but it's typically manageable with mild oral pain medication. At home, you will need to avoid heavy lifting, bending or twisting for a few weeks while you heal, which is advised by your doctor. That said, you can get back to light activities as you feel up to it in a week or so. In general, people return to their normal daily activities within a few weeks of this surgery.